Welcome, everybody. Welcome to the 10th edition of the final show. We mark today the 10th anniversary of Design for Government course, and we are so happy to celebrate with you. Thank you for joining us today. I'd like to see a quick show of hands of how many DFG alumni we have in the room. Do we have anybody from 2014? Wow, yes, Neta. Very nice. Also, we want to thank you, Kela, our partners from this year, to let us host the event here. It's the second time we do it. We did it also in 2022. So thank you so much for letting us to use the space. It's always a joy to be in this room. For those who don't know us, since 2014, we've been working with Finnish ministries and public services. Design for Government is a course that belongs to the Creative Sustainability Master Program that aims to use the design approach in a practice-based course with the Finnish ministries and public services that we partner every year. With me, this year, in the teaching team, I have the pleasure to have my colleague, Marco Steinberg. Yes. Natalia Villaman. And then, as teaching assistant, DFG alumni, Carlota Carvalho. Thank you so much. This year, we had 24 students working in 6 groups with 4 partners over the period of 12 weeks. This is the plan for today. I will just take some minutes to introduce a bit the course and also the design approach that students have been using as part of their projects. And then we will start with the first groups. We will first go through the policy coherence for biodiversity, the first project of this year. Then we will have 3 groups presenting, 15 minutes approximately, and then we will conclude with a panel with our stakeholders. Then we have a coffee break and do the same dynamic with the second project, continuity of care. We expect to close approximately at 4, but we also welcome to stay and celebrate the 10th anniversary and the end of the course with us. Just as a reminder that you have a leaflet on the seats, you will find a QR code there. We also ask you to provide comments and feedback during the presentations. We'd love to hear your thoughts and inspirations. And also that we are recording the session. We are also taking pictures, and we will be sharing all of this on our platforms at the end, probably mid-June. But let's first talk about the design approach that we use in Design for Government. As the basis of our thinking in Design for Government, there's this foundational notion that policy development shouldn't be 2 separate parts. But instead, we see it as a loop. You can see in this diagram. We see that policy and implementation should inform each other instead of being 2 processes that are separate and have delays. We believe that these 2 could be thought together and inspire each other. How do we translate this into the course? What we do in the 12 weeks, we split the design process in 2 parts, what we call defining opportunities for the first part of the course during the first 6 weeks, and then we continue on a mode of propositional mode, as we call it, defining change. But we continue with this ethos that one informs the other. Analysis informs execution, and execution helps us reframe our thinking and continue to explore. In the first part of the course, in defining opportunities, we combine different approaches, human-centered research with systems analysis, followed by a couple of weeks of understanding our context, understanding the projects, understanding the topic area of our projects. And we always involve our partners in participating during the course. And in this case, we start the course with a roundtable discussion to unpack the project and discuss the challenges together, and then we wrap up with a midterm presentation. For the second part of the course, Defining Change, we combine defining entry points, influence with a behavioral approach, and then defining proposals by imagining a future vision and a narrative for change. And here we also ask for the help of our partners who participate in an ideation session, imagining with us what change could look like. And then we invite them here at the final show that you will meet later today. Let's start now with the first group, Policy Coherence for Biodiversity. I will first introduce, they were about to take the mic from me already. I will first introduce very briefly the project, and then I will invite the group to present. In this project, we have partnered with the Prime Minister's Office and the Ministry of the Environment, who are currently working in this concept of policy coherence for biodiversity, which explores and kind of recognizes that for Finland and for the world to be able to tackle biodiversity loss, we need a different approach. An approach in which government is coordinated across ministries, horizontally, vertically, across all the administrations, and then internally across all the departments. These three perspectives, we call them horizontal, vertical, and interdepartmental, are the perspectives that each of these project groups have been exploring. But before I introduce the first group, they will present a shared vision that all the groups have put together, by which all the projects will respond in their presentations and proposals. Please welcome the first group, Biodiversity, Policy Coherence for Biodiversity, Group 1A.
Thank you. You can keep it. Okay, welcome to follow our presentations on my behalf as well. We are very excited to be here. Let's start with the shared vision from our three bio groups. Our vision is for Finland to embrace its role in biodiversity, ensuring a total coherence in our policies regarding it. By integrating diverse perspectives and working within planetary boundaries at all government levels, we put the biodiversity on the top of the national agenda and work to realize a future in which humans and nature are one. During the spring, our team 1A has been looking for opportunities to improve policy coherence horizontally across different ministries. My name is Meri, then we have Lee, Camilla, and Arpa, also in our lovely team. The main partner of our work is the Prime Minister's Office. When we started our work, the secondary research helped us to understand that the policy design process is not a linear event. It is a circular one. Our first key finding is that policymakers have an unconscious assumption that all participants have a shared understanding. However, in reality, biodiversity knowledge and skills vary widely between ministries. And not all civil servants know how to contribute to this in their own work. As we studied the policy process a bit more closely, we realized that instead of the circle itself, it's a bit fuzzier, with small iterations within it. We also understood the scale of it. The current policy process is not necessarily the first one, and there will be new rounds where the iteration of it continues. We also realized that instead of just one process, there could be up to 200 biodiversity-related processes taking place at the same time. Another key finding is that bio-related policy and strategies are fragmented. And sometimes they overlap between different ministries. We learned that 2/3 of the objectives implemented from the latest National Biodiversity Strategy 2020 had little positive impact. Finally, there is a large gap between what science states and what policy supports. Science has a strong role to play in finding biodiversity-related solutions, and we recognized that its role needs to be strengthened.
Thank you, Mary. In summary of Mary's introduction, we identify 3 problems from our 14 weeks research. So firstly, we have isolated understanding of biodiversity. And secondly, we had fragmentation of policies. And thirdly, unclarified role of scientists. To addressing these 3 problems is never an easy process. So to help us, our partner, to get started, we propose the primary step is to identify those who are willing to initiate or even orchestrate new changes, or what we call them, the biodiversity change agents. Here, we present you our proposal, named the BioLinks via Agent of Change. In our proposal, we pave a way to pop the bubble, connect them by links, establish a cohesive network, and in the end, support change agents to implement biodiversity value in their daily works. A good news is, this process is not start from the scratch. Today, our partner already sees some officials within the organization who are highly motivated in change making and in their daily works. And these potential change agents, together with the Prime Minister's office and the science panel, already lead small-scale discussion in their contexts. And we don't want to deconstruct this change agent from their current position. However, the links between them are currently missing. Besides, those change agents in the vertical agency and the interdepartmental unit now has more obstacles in their involvement. So regardingly, we propose 4 steps to establish the unified network between the change agents. This process, similar to the policy circle, might take 12 months, and we suggest to iterate itself afterward. And I will give the floor to Camilla now. She will guide you through the 4 steps and more in detail.
Thank you. So the first step of our action plan is establishing a biodiversity change agent network in the central government. And the path to change starts with building a network of the possible change agents. So we envision that change agents work in a formal and informal framework. The main facilitator of this step is the Prime Minister's office, who play the crucial role of orchestrating both the work of change agents and the recruitment. And this formal group makes up a board of bio-change agents. And this board is made up of at least 1 change agent per ministry. They ensure that change agents can work on biodiversity topics in their daily work. On the other hand, the informal actors can come from all levels of government on a voluntary basis. And the actors can have a varying prior understanding of biodiversity, and the only connecting link between them is that they are interested in integrating biodiversity in their work. And although we showed them separately as 2 types of groups, these 2 informal and formal members of the Bio-Change Agent Network work together in a non-hierarchical manner, and they are closely collaborating. For the recruitment, it takes part in 3 separate steps, starting with mapping the existing change agents. So as Lee has mentioned before, there are already some individuals within the government that can be identified as change agents. And these change agents can be integrated into the new network. Secondly, after identifying the change agents, they are invited to an informal gathering. And this informal gathering can be anything from a dinner or a picnic. And the point of this is to start building the community between these change agents. And finally, we propose that that we create an online network for change agents so that they, on a platform like LinkedIn, so that they can promote their work in an official context. Our second step is called Unifying the Path. And Unifying the Path starts with identifying a strategy, a common strategy for all participants. And this strategy is based on the National Biodiversity Strategy and Action Plan of 2035. Based on this strategy, we propose creating a shared vision. At this step, it is critical for participants to communicate transparently about their conflicting and shared values. And this will make way for smoother collaboration in the future. And the last key step of this section is assessment. In this part, the values and incentives are reevaluated to prepare for the next cycle. And the tracking of progress and the future impact assessment are key for this step. And we recommend a toolbox that consists of frameworks for this phase. And it includes tools from the OECD, tools from the UNEP, the 6 foundation stones of cultural transformation, as well as the example of the Forest Academy. Thirdly, we introduce creating links. So creating links refers to the points of contact between change makers to interact within the community and to get guidance integrating biodiversity into their work. So points of contact are created at different levels of formality, starting with an online forum, which is available 24/7. And at this forum, questions and comments can be raised with a very low threshold of entry. Secondly, we have coffee sessions, which are organized and hosted by a different ministry each week. And during these informal sessions, biochange agents can discuss their own experiences, or they can seek out guidance from other change agents. Then, to educate the community, the Prime Minister's office organizes science lectures and clinics monthly. These sessions are voluntary to attend, but they also provide a very much needed connection from science to this network of change agents. When we have identified that science is a very important part in the biodiversity discussion. And then finally, we have a formal meeting, which is organized by the Prime Minister's office. And this meeting allows for change agents, both from the formal and informal group, to reflect on the shared goals and partake in some sort of impact assessment. And participants can be kept informed about these points of contact through a simple contact sheet, which biodiversity change agents would receive when joining. And this serves also as an introduction to the community. And then our final step is assessing the strategy. And although we have placed this as our 4th step in our process, it doesn't mean that it only occurs at the end of the cycle. It occurs at 3 different times in the 12-month term. So in the first month, we assess the current status of change agents and the change agent network. Then in the 3rd month, we assess whether targets are shared within the network. And finally, at the end of the term, we assess whether these targets are met by the ministries and if they have been completed. And then these regular assessments and reflections, they enable for timely adjustment of the change agent network for the next cycle. Yeah. And this concludes our 4 steps towards establishing an efficient network of biochange agents. And Arpa will now offer some reflections on this.
Great. Thanks, Camila. As we conclude, let's look into how our proposal is remodeling the existing system. Our approach draws inspiration from the success of the working group that the Prime Minister's Office brought together in spring 2023 for sustainable development. This initiative formed a strong base of trust between the Prime Minister's Office and the ministries, outlining a promise for a policy coherence approach. In our proposal, we expand this network further beyond the ministries, focusing on its interdepartments, the vertical agencies they're collaborating with, and also the scientific panel. We see that facilitating this change-making process will also strengthen Prime Minister's Office leadership in bringing radical transformation throughout all levels of the organizational system. Now let's look into how the information is currently flowing. Following the traditional top-down approach is exactly why there are knowledge gaps being created and incoherency of shared values. Also, the integration of science is still unclear and siloed. By creating the change agent network, we visualize that the information flow right now will rather be like a fountain. Let's look into it how. From bottom up, now the vertical agencies will address directly the challenges of local implementation directly to the science and the policymakers. This, in turn, will outline policies that are coherent, backed up by science, preventing backlash, and bringing impactful change in supporting biodiversity. We believe that bridging spheres of science, policymaking, and service practices will ensure actions are taken beyond the direct drivers of biodiversity loss, but also addressing the root causes of it. Our team is very excited to share our proposal today in front of such a community whom we believe are active members of the system. And we conclude by asking you, are you the biochange agent that our system needs right now? Thank you.
Thanks a lot, Group 1A. Now we have 5 minutes, and we'd like to hear from you. Question. Any particular thing about this proposal that resonated with you? Also, you can just raise your hands and be ready to catch the mic, or we invite you to scan the QR code and also give your comments in writing. Yes, back there.
It's a mini practice.
Please stand up. Betsy is a friend of the course, DFG alumni 2020. Yes.
Something like that. It was COVID years. It's
It's fuzzy.
beautifully clear presentation. I really like this kind of mobilization of people that are already interested. But there's one little point that I was wondering about. These science clinics, how did you decide between voluntary and mandatory? Because as someone working in a civil servant role myself, our time is always in demand. And I think if something is mandatory, then it gives me the freedom to really put that in my calendar, be invested in it, and feel no guilt about being there. Whereas if something were voluntary, which I feel these clinics are essential to the functioning of the whole ecosystem, kind of, then I might easily get pulled into something else last minute, or something that someone deems more important. So just curious about the process and your thoughts about that, but very well done. I loved it.
Thank you, Betsy. How do you think we could prioritize these science clinics?
Well, I think that through our network, we kind of are already promoting that science is important. That's number one. And number two, by voluntary, because we want this to be something that you're motivated. We don't want to kind of like exaggerate on the individuals. And I think the fact that you're part of a community should be the reason why you're being driven, rather than, I mean, I understand that time is a catch always, but we're talking with our partners, we really see that people who are driven are the people who are willingly to show up, because this is the existing problem within the system, that the integration is missing. But we believe that having people join in a more motivational spirit is kind of the more successful way of doing it, rather than imposing you that, hey, you gotta be there because this is important, or else, like, because we have seen similar practices where every year in the beginning of the year they put the policy and tell its co-worker that, oh, do you know what it is? But we don't want that to come from more like a stiff kind of approach. But I do understand that voluntary might create that kind of confusion, that, oh, whether it's really important for me or not. But thank you so much for your feedback.
We still have time for another question if anyone would like to catch the box.
Yes.
Wait a second, the mic is coming. There you go.
Here, you ready?
Hi. Nice job. Question, it seems like the approach was to create a bottom-up swirling of information and communication, and then part of that feeds up to reinvigorate policy. But I didn't see anything that described how you would make coherent communication, prioritized communication, and aligned communication so that whoever's up gets it.
Thank you.
Thank you. All right, that's me again. I personally feel that, okay, give me a breather to process the information in my head first. All right. What is currently missing is the way the information is flowing that I kind of show from a top-down model. But through our network, we're bringing people from different levels together. And we believe that having that kind of space where you're comfortable, because we have interviewed multiple people from different levels with brilliant ideas, but somehow the institutional sphere kind of like creates them that, oh, maybe I shouldn't take this step forward because, you know, I represent this ministry, or this is what my ministry represents. But we believe that the first impression is creating that safe space where everybody is coming together. And we believe that is the step where communication and conversations will flow and ideas will be changed, because that safe space of everybody coming together is the first missing point at this scenario. I hope that helps.
Very well explained. Thank you so much, Arpa. Thank you very much, Group 1A. Please give it up to them.
Thank you.
Up next, Group 1B. Please take the stage.
Hello, and welcome to our presentation, Breaking Silos for Biodiversity. This is Ellie, Anu, and Jing, and I'm Jamie. We are working on the Biodiversity Policy Coherence Brief with a focus on policy coherence within the Ministry of the Environment between different departments. To begin with, let's start with some background. Why should we be concerned about biodiversity loss? Well, biodiversity is essential for the processes that support all life on Earth, including humans. In this diagram, we can see that the inner circle is a safe operating space, and to live sustainably, we need to operate within the boundaries of this circle. As we can see here, the safe operating space has been overshot massively, and we are on the brink of a mass extinction. It is clear that our planet wants change. But what are the national governments and the international community actually doing to enact this change? This is a pressing question, as policies by governments will play an important role in any attempt to halt biodiversity loss. So, there are international commitments for biodiversity facilitated by entities like the EU and the UN that call for collective action. This policy flows down from the international level to the Finnish government and down to the Ministry of the Environment. And by the time it reaches the external experts who work alongside the ministry on policy, there's been a loss of the shared goals for biodiversity. And shared goals are essential for effective action on biodiversity as an issue because it does not respect the boundaries of ministries, departments, specializations, or national borders. So, in practice, how is biodiversity policy actually being implemented and worked on by the Ministry of the Environment? This diagram here shows the structure of the ministry. At the top level, we have the ministry itself. The level below, we have the 4 departments, and below are the projects. And projects can come in many different forms. Some can be big, can be small. For example, some can be legislative, or some could involve working with local government. The main way the ministry works on policy is primarily through these projects. And these projects will often have different departments working on them. They can be interdepartmental. Researching this structure led us to one of our key insights. Though projects are interdepartmental, they are often siloed by topics. Projects aren't aware of what each other are doing. There is also no overview of how the projects within the ministry as a whole are affecting the top-level biodiversity goals. So why has nothing been done to tackle this obvious barrier to policy coherence? We don't have enough time or resources. This is a quote that came up from one of our interviews with civil servants, and as we saw with the conversation earlier, it's a pressing matter within government. And it came up again and again in multiple interviews that we did. Initial ideas suggested for breaking down project silos, such as increasing the amount of meetings and communication between projects, were rejected for reasons of time and resources. So how might we break these project silos? Whatever we do, we'll need to keep these barriers in mind. And now I will pass you over to Ellie, who will look at answering this question.
Thank you, Jamie. So now let me present to you our proposal for how to break the silos. The general idea is a new standard practice at the Ministry of Environment that acts as a kind of a traffic light. It coordinates a complicated system. It highlights where the Ministry of Environment's projects clash with biodiversity, and it guides the ministry in a better direction. It is composed of 2 parts, a matrix and a steering group. And let's first take a look at the policy coherence matrix for projects, and also the workshops around it, which it is built with. So here we have the empty matrix, and we will now fill it together with the process of the workshops. So this process requires expert knowledge on both biodiversity and policy. So us as designers, we have just used the upcoming National Biodiversity Strategy 2035 to draw examples. So it begins with a workshop between the Ministry of Environment, the Prime Minister's Office, and external experts on biodiversity. The purpose is to define a high-level goal and targets inside it that acts as a guiding star for biodiversity in the ministry and in the matrix. The goal we have set here is to reverse biodiversity loss by 2035. And inside this goal, there are targets. And an example could be that pollution is reduced to a level that is no longer harmful for biodiversity. And then we have visualized a target 2 and a target 3, and so on. The second workshop is between the Ministry of Environment civil servants and scientific experts from, for example, the Finnish Environment Institute, SYKE. The purpose is to create science-based indicators for targets, and the projects will then be evaluated based on these indicators. We have drawn 2 example indicators from the Strategy 2035 for the pollution target. An example could be decreasing the amount of microplastics in water and decreasing the amount of pesticides used. And similarly, target 2 would get indicators, and target 3. And these indicators are then re-evaluated by experts annually to match the most recent scientific knowledge on biodiversity. Now that the matrix has been set up, it's time to add the data. As a new standard practice at the Ministry of Environment, at the planning stage of a new project, the project is added to the matrix through a workshop, and the workshop is between civil servants from the project as well as an external expert from Syke, the Finnish Environment Institute. The y-axis here represents the projects, and we could here have, for example, the Ministry of Environment project Helmi Habitats Protection Program, which aims to strengthen biodiversity as well as protect ecosystem services. And now the project is assessed based on each indicator, and the assessment scale is from a -3 to a +3, the -3 being very contradicting to the indicator, the +3 working well towards the indicator, and 0 being neutral. And we have chosen this 7-point scale because it offers a nice variety of options, but it's not too overwhelming. And the numbers we present here are just illustrating examples, as we are not civil servants working on these projects, nor are we Syke experts, so take these as illustrations. So for example, Helmi could get a +2 on decreasing the amount of microplastics, which means it's doing quite well in this indicator. And then for pesticides, it could get a neutral 0, which means there's no noticeable impact in either direction. And then the same is done for each indicator. And the same is done for the next project. So, for example, the National Chemicals Program, which re-evaluates and updates the National Chemicals Program to better protect health and the environment. And like with the previous project, it is evaluated on the microplastics indicator. With a -1, it means that it's giving slightly negative impacts on the efforts to reduce the microplastics. And then it is evaluated on every indicator. And the process goes similarly for all projects. As an important part of the workshop, the participants also would reflect on the reasons behind these numbers, especially when there are alarmingly negative ones. And as the matrix is starting to fill with projects, we start to see beyond these project silos, and we get a more comprehensive picture on the effects of the Ministry of Environment's projects on biodiversity as a whole. Moreover, our proposal also goes beyond the matrix, and now Annu will tell you a bit more about that.
Thanks, Ellie. In this section, I'd like to introduce how this new practice will be guided and will be implemented within the ministry. Just as every complex traffic light system is controlled and coordinated to ensure that traffic and pedestrians move smoothly and safely, we recommend establishing a steering group within the Ministry of the Environment. This steering group will lead and support this new standard practice from its pilot stage to ministry-wide implementation. So let's take a look at who is part of this group. To start with, we advise that representatives from each department of the Ministry of the Environment to be part of this group. Additionally, a representative from the Prime Minister's office should be included to bring in a different layer of authority to the group. We also recommend including external scientific experts from the Finnish Environment Institute, which is Syke. And finally, a representative with expertise in international policy affairs should be included to complete the steering group. Beyond leading, the steering group will ensure that the matrix filling workshops that Ellie mentioned while filling the matrix, that runs smoothly, and they're also responsible for analyzing and reporting the matrix findings and the results of the new practice to the entire ministry. These findings could be presented at the ministry-wide meeting hosted by the permanent secretary of the, where all the civil servants are present. To kick off this practice within the ministry, the steering group also defines a step-by-step implementation plan. Once the steering group is established, The second step would be to pilot a version of this matrix with at least 5 Ministry of the Environment projects, which is then monitored and evaluated. Once the pilot is successful, the practice is implemented ministry-wide for all the projects. Now, for some justification, we've gathered some data and evidence to justify this new practice. One such evidence is that the matrix methods have been tested and used in 6 cities in Europe. Second, we have consulted with data experts who use similar quantitative methods to analyze and compare climate data across various international projects. And thirdly, we've discovered that using simple matrices and monitoring tables is not an unfamiliar practice to the civil servants. They've already been doing this on a daily basis, but at a smaller scale. And finally, to hand over to Jing, who will present the future opportunities of this practice.
The new standard practice provides a comprehensive view of projects from a biodiversity point of view. This provides many opportunities for the Ministry of the Environment. Firstly, quantifying things that are difficult to quantify can spark discussion and act as conversation starters for more biodiversity discussion. Secondly, it can further be used to improve project efficiency by recognizing early incoherence towards biodiversity. This helps overcome the time and resource struggles of the ministry. In addition, project actions could be combined for higher efficiency by recognizing more effective projects for biodiversity and identifying overlaps. Thirdly, the standard practice also visualizes and informs the efforts of the Ministry of the Environment regarding international commitments that Finland has made. Now that the new standard practice is established at the Ministry of the Environment, let's take a look at some future opportunities. The new standard practice can lead to coherent and efficient biodiversity policy at the Ministry of the Environment. Then, the Ministry of the Environment can share and implement the practice across all ministries to pursue government-wide biodiversity policy coherence. And you might wonder, what kind of biodiversity future we envision as a result of all these steps? In our vision, Finland meets its obligations to international commitments and sets a best practice for countries across the world. Through global cooperation, we can achieve the restoration of biodiversity. And together, our planet can be happy again. Let's break the silos. Thank you.
Thank you. Please stay. Please stay here, Ellie. Yes? Okay, very nice. I thought you were escaping. Same dynamic. We'd love to hear from you. You can type it on the QR code. Or also, you can be brave and raise your hand and catch the box.
You ready?
Robert.
Yeah, thank you for your presentation. It was very clear and understandable. I was just wondering, is this metric also helping you to define the urgency of different projects, or just to compare them in respect of your targets?
Sorry, did I catch urgency?
Yeah.
Okay. Yeah, I think in terms of urgency, it kind of clarifies what the state of the Ministry of Environment's actions towards biodiversity are. And since we are crossing the biodiversity boundary at a very alarming rate, then if we see a lot of incoherence, it at least gives a lot of visualization to the ministry-wide urgency on these biodiversity actions, and also seeing how different projects work together. If they are going against each other, then this calls for urgent change of direction for especially the projects going against biodiversity. So in that sense, for sure, and it can, of course, be developed further as well and added different layers. We know that there have been different additional sides to these matrices that have been already developed. So through those, we can get a more specific view also on singular projects. But we want to mainly focus on how we can collectively and coherently work towards it with all projects.
Thank you.
We still have time for one more question. Anything that resonated with you or radical? Yes. Camila, DFG alumni from last year. Recent graduate.
Yeah, not yet, but close.
Close.
A month from.
Very close.
So I really like the whole idea. And actually, a few weeks ago, I was reading some articles from one researcher at Tsuke that was researching on projectified governance of environmental policy. So I think like this is like already a match on what that institution is doing, which is not only researching on biodiversity, but on how like biodiversity is governed somehow. Then I wonder, I really like the matrix, and I think like it's good that you pick on a practice that's already like standardized, which is filling a matrix. I only wonder like if there could be any like way of registering like these discussions that they will have for filling the matrix, because I think there might be some rich stuff there that's not like a number or a light that would be interesting to have. Yeah.
Very good question. Thank you, Camila. Have you thought about what happens in the workshop beyond the numbers?
Not quite yet, but like how Ellie already mentioned, like the matrix can take any form. So this is our iteration of it. The civil servants, I'm sure they know their work very well, and they're much more closer to it. So the matrix may not even look like this once they have sat on it. So it's going to maybe look like something else altogether. And definitely that point has also been discussed in our group. Even the indicators need not be that small. It can be sentences even. So then how does the matrix sort of accommodate things which cannot be put in a very closed box? Then definitely we need more discussions. Then we might have to do beyond the matrix. We might have to record the discussions or sort of somehow document it, and that would also be really nice. Yes, thank you for the question.
Following on that, I wanted also to give you the opportunity to explain. You mentioned that some of these are already used. What's different about this practice? Is it the workshops and bringing people together one of the core aspects? And why is this important for coherence?
I think, yeah, one of the main differences of what we're suggesting is the scale. So currently it's used in the ministry at a very simple scale for smaller projects. And we're suggesting ideally that you start with a trial and then scale it across the entire ministry, which we think, though the practice is similar, the end function will be very different in that it's a much more effective tool for overall coherence when it's scaled to the size of the ministry.
Super, thank you so much. Let's break the silos then. Thank you so much. Please give it up to the next group. 1C, the last one for biodiversity.
Dinah, I've been reviewing the proposal for the new logging site. It's going to decimate a critical habitat for the Pikku Apollo.
We've done our due diligence, Anna. It's just a little butterfly. Our prosperity outweighs the environmental concerns here.
Whose prosperity? We can't keep prioritizing profit over the well-being of our planet.
And we can't ignore the economic realities. You know we are dependent on ensuring returns.
Well, there has to be a middle ground here. We can't exploit our natural resources indefinitely. In the end, there won't be any.
We're not exploiting anything. We're utilizing them sustainably to drive economic growth.
Sustainable logging, that's an oxymoron, Dinah. Once that habitat is gone, it's gone forever.
And so what do you propose, Anna? Should we shut down the entire operation and have hundreds of people out of work?
In line with what we just saw in this little scene, an expert from Motiva told us quite early on that they see at the root of these issues and these conflicts, they see the human things and not necessarily the data or engineering approaches. But wait a minute, hold on here. We're moving a bit fast. Who are we? My name is Anna, this is Dinah and Yandi, and with us we also have Sari. So what have we been doing the past 12 weeks? Since we got our brief, we have been doing a whole lot of desktop research and a whole lot of interviews. Then we did some systems mapping, even more desktop research, and then we moved on to ideation, where we found our concept that we have validated and iterated and are now finally ready to present to you. So, you know our brief, but let's talk a bit about our scope. This is what we call the Russian doll of policy, biodiversity policy implementation. It starts at the top levels from the global and the regional, which the UN and the EU. And then we have the national, which in our case is the Ministry of Environment. And then the sub-regional and local, which are the service institutes, agencies, and research institutes, on the top level, we find the jointly agreed objectives for these biodiversity policies. Then we have the policy planning on the national level, and the implementation itself in the sub-regional and local. And this is where we have had our focus, and we call these two circles the vertical ecosystem. So, what is it about this vertical ecosystem that enabled the conflicts that we saw? What is the urgency? First and foremost, policy coherence is not the natural state of governance. Let's just acknowledge this fact. Because of the traditions and the history of democracy, it's inherently siloed, and breaking those silos do take time, but we see the importance of doing so. Different definitions and interpretations of the term biodiversity do exist. That's both because it's such a concrete and an abstract term at the same time. And these different interpretations also exist between the people who work with this every single day. And when you don't agree on something, it's hard to communicate. We also see that the people who work in these, around these issues are people who are emotionally attached to their work. They care about what they do, and they value their emotional experiences. So we see that in the end, it's about people. Yes, last but not least, there is an increasing amount of political stress in the world, not just regarding the climate crisis and the loss of biodiversity, but it seems there is a growing unwillingness to understand each other in the public debate. But there is a bright side, maybe. Approximately 90% of Finns consider nature to be important or very important. But how can this really be true when we are facing the climate crisis and the loss of biodiversity? While some see nature as a resource that can be quantified in monetary terms, others value it more for its intrinsic value, its right to exist just because it already does. These multiple values of nature directly affect how we view and move through the world. Now, we're not the first who are interested in this. The lovely IPBES report came out a couple of years ago, but as you can see, it was hard to convert it into action. Therefore, we see the opportunity to make the multiple values of nature visible by recognizing the different ways in which people value and relate with nature. So, we want to move from a status quo, which is a lack of shared understanding, and to a paradigm shift of behavior within the limits of planetary bounds. But this does seem like quite the leap, right? Why don't we first take a human-sized step and visit our entry point of making the multiple values of nature visible? And how are we going to do that?
Thank you, Anna. And on behalf of our team, I will proudly present you our proposal, the Nature Dialogue. So the Nature Dialogue brings people to build dialogue around the multiple values of nature. As a project-based entry point, Nature Dialogue offers opportunities to learn about different viewpoints, to create shared understanding, and to integrate the multiple values of nature in decision-making. So within the context of Project Kickoff, we want to engage the participants with the archetypes that represent the multiple values of nature. So these archetypes are considered through the different lenses of how people conceive of or relate with nature. First off, we have the sage that represents the mental model of living as nature, harmonizing with nature as one. This archetype sees nature as co-inhabitants. Second, the shepherd represents the mental model of living with nature. This archetype describes the stewardship and responsibility by showing respect for the intrinsic value of nature. Third, the explorer highlights the mental model of living in nature, which describes humans see and appreciate the benefits of health and belonging of nature. Last but not least, we have the hunter that represents mental model of living from nature. This archetype sees nature as resources for prosperity and livelihood. So with the use of these four archetypes to present multiple values of nature, there's no right or wrong or strong or weak value. The purpose is to use them as a metaphor to understand each individual viewpoint and improve communication in project setting. So you may wonder who are going to be involved in this kickoff, for example. Participants from the same project are selected within the vertical ecosystem to form the core project group. So ideally, the core project group should include these representatives that you can see from the slide. Facilitator is an external participant. Could be a change agent or it could be a project coordinator from a different project to maintain neutral during the dialogues. We also envision the kickoff that has limited participants to ensure the high level of engagement. So each core project group should consist 6 to 12 people. For that reason, it's crucial to select the diverse set of perspectives from decision makers to civil servants. Now, let's go with me and see how the proposal looks like through the story of Nature Dialogue. A researcher from Metsähallitus gets invited to a project named Forest Restoration Kickoff in Vihti. And she's really excited to take the day off from the office and just be in nature. So from here, an open dialogue is kickstarted by the facilitator to explore different personal values on the project. And this is a great opportunity that participants can open up about their values outside of traditional work setting. So from here, as the dialogues progress and mature by the guidance of facilitator, the group experiences different ways that others value and relate with nature. And with the help of the archetypes, they are able to look at the problem more constructively by putting themselves into different shoes, learning about other existing values. After role-playing different archetypes and familiarizing with multiple values of nature, participants can now apply these values to group discussion and integrate them into their project, because change happens when people share meaningful experiences in rich and real-world contexts. As a result, individuals also get to self-reflect on the multiple values of nature. They may question, how do my values fit in with the team's and institutions' values, and how do that influence my life goals, and so on. So as more reflection occurs, individuals can now understand the multiple values of nature and build a sense of agency towards the nature relationship. So having the momentum build from the kickoff, the concept multiple values of nature can spread the seeds to different projects and different teams. One person comes out of this core project group, can bring the notion multiple values to different people and then different circles. And through, just one moment. And eventually, more and more individuals are aware of this, and they will refer the archetypes in conversation more naturally. And through the small conversation, the term multiple values of nature continue to spread and will be the metaphor to talk about values of nature. So through our proposal, we want to drift away from the misunderstanding on hidden values to understanding based on visible values. But what are the barriers in future that we're looking now? And Dinah will talk to you about this.
Yeah, we'll not also talk about the practicalities of reaching this ambition. So what is needed for these changes to happen? First of all, we believe that a mandate by the Prime Minister's Office for neutrality in supporting this work will be essential, and also that there will need to be funding to cover kickoff meeting costs, to be in nature, and also the cost of the facilitators themselves. Thirdly, capacity building or training for internal facilitators who will do this important work. We've also learned about what may be barriers to change for making this ambitious plan. First is volunteer fatigue, and we've heard through feedback interviews that change agents in the network are already going above and beyond their job descriptions, and if they are asked to take on additional roles, such as being facilitators for this Values Dialogue program, they could be reaching a burnout stage. So ideally, this facilitation role would be considered part of someone's job as opposed to an extra task. So we also heard that if political will is not in place to support new ideas like these values dialogues, they will just wither. And then thirdly, that we learned that sometimes political pressure is coming from outside of Finland. For example, we learned through an agency interview that the EU is quite keen for critical mineral mining to increase in Finland. And lastly, in most of the interviews we held, we heard that current financial pressures are very tight, and that the expectations of raising capital through natural resources is very high. Let's look now at how we can see that the nature dialogues can unlock future opportunities. Looking back at our entry point of recognizing the multiple values of nature and moving towards meaningfully including the multiple values of nature in decision making. We then see the opportunity for this to grow and formalize across sectors. Organically, this network will grow through more and more members of these 4 sectors participating. So that's national decision makers, politicians on 4-year cycles, all of the ministries, the departments within the ministries, and the agencies and research institutes who support them. Over time, we also see that some formal structures can be put in place to further promote policy coherence around biodiversity. For example, there could be a modernized version of the Forest Academy, which is a formalized version of the nature dialogues, oriented towards higher levels of policy making to help foster political will. And as the program grows, a nature lab that supports policy work and coherence could be formed. This team could, for example, train and provide cross-sector facilitators. And when enough momentum builds towards this way of working and truly understanding others' values and viewpoints, a tipping point and paradigm shift will occur. One that enables the kinds of behaviors and decisions that work within the limits of planetary boundaries. So here's a recap of taking these small steps throughout the whole process. So we see that for a paradigm shift to happen, people need to understand each other, not necessarily agree with each other, and that's the nature dialogue. Thank you.
Thank you very much. I wonder which one of you are now in this in these new values. Questions from the audience. We'd like to hear also your comments on writing or by raising your hands. Emilia, another DFG alumni.
Yes. Hi, everyone. Emilia from the Department of Design. So I have two questions. I first have the question about the profiles that you have, because I have a feeling that there might be one profile that is missing, and that is someone who does not recognize value of nature and their relation to nature. So I'm curious if that was a conscious decision for you to exclude that profile. And then the second question is that based on research in environmental psychology, the same person can have different perception of nature in their private and professional lives, and also according to the context that they are in. So I'm curious if you had similar types of discussions of, can you only identify with one profile? And then how do you encourage critical self-reflection when people might tend to identify more with the better or the more connected version of relationship than they actually have? So, two questions.
Thank you so much, Emilia.
I could take part of it. We definitely thought about that people could have primary and secondary kind of values. And in fact, if we were going to go further with this, there would be sort of probably at least 3 subtypes for each of the main types, but we just wanted to focus on the main roles. I'm curious about the who would be left out completely, because we do have the people that just like to be in nature, and if someone's not that, then yikes for us, I guess, as humanity. But so I think we have the core things covered, and there I'm sure could be nuances that are missing.
Yeah, and I could add to that in the validation interviews, we kind of heard from the experts who have been working with biodiversity values quite long that they are so bored of this intrinsic and relational and that level. And the archetypes would be good because they're so simple. So they're kind of the starting point for discussion for people who are not that familiar. And then through the facilitation, they could go deeper. And like, but foremost, it's kind of simple to start with the 4 and then go deeper. I hope that kind of answered to your question. Thank you.
I can add that our intention is that people should like pick one and be the one. This isn't a personality test, kind of. So, as you say, that people have different values of nature related to their context. I think I'm probably all of these at some point during the day, but at no time am I the sage throughout the whole day. And that's the point, that we can see from different perspectives and not just a singular one.
Thank you very much. We have another question up front. From Rita.
Hi, Rita Komolainen from the Ministry of Environment, and I wrote something down. Thank you for this. It was very good. I just have some questions. I think you based this idea on mixing these kind of archetypes. So have you thought about the situation when maybe in some certain types of workplaces, there may be a lot of similar people who have the same archetype, so mixing doesn't necessarily happen. And also, I feel like this kind of places a lot of responsibility on the individual to make change happen. So do you have some ideas about that? But thank you.
Thanks a lot, Rita. Who would like to take the question?
Well, I feel like that was many questions, so I need to maybe recap a bit. Anybody else?
Well, about placing the responsibility to the individuals. Well, yes and no, because we all have a responsibility for the way we act in the world and also towards each other. And by putting this in a facilitated setting with a person who leads the conversation, it's not about out to get someone or to shame someone. It's how can we put these values on the table and discuss them as they are instead of pointing fingers. But we also do see that and hope that through these dialogues that people will be able to confront their own values and hopefully change them if we want to save the planet, I guess.
Okay, and I think I got my thoughts now with the diverse perspectives. We wanted to kind of highlight that indeed there needs to be diverse perspectives included in the nature dialogue. So if it happens that none of the core group members would not kind of come from having different kind of values, then I think the stakeholders should be invited outside the project context to provide that kind of very different perspectives. It also came up in the research that to have plural valuation to be efficient and actually take into account the multiple values of nature, we need to have all the different perspectives of like stakeholders outside the project and so on. So yes, we have a little bit thought of that. Thank you.
Thanks a lot. It sounds like mapping the diverse perspective could be a good starting point to see where diversity is or lacking, and maybe a conversation starter to discuss if we are missing archetypes or how is my day today fitting on those archetypes. Thank you so much, Group 1C. Give it up to them. Up next, and to conclude with the first block with policy coherence for biodiversity, we now invite our two partners representing the partner side of this project, Eva Furman and Sari Pipo, who have been accompanying us in this journey of figuring out coherence during the course. And this will be moderated by Natalia Villaman, and we also invite our student representatives from each of the groups. Please come to the fore.
Please.
Yes, big applause.
This is for the two of you. All right. Thank you for your lovely presentations. I will immediately jump to a question for our partners, and also thanks to you for being so involved in our students' projects. First question for you, whoever wants to take it first. Let's talk about strategic questions. What do you think are the big strategic questions and considerations that we need to advance these agendas on policy coherence in Finland?
Okay, I think I can start. So thank you for inviting us and thank you for the possibility to join. I'm from Ministry of Environment, so I can present the point of view from that ministry. So I think you gave us so much great ideas, so I'm not sure which are my ideas and yours. And so I think we have, as you mentioned, silos. We have problems with that, sharing information, and we are too busy in our roles. So maybe that's preventing us to go on with the biodiversity issues. So we need to both top-down and bottom-up perspectives. We need to share our knowledge, and we need to have plenty of discussions, be open to each other. So maybe that will help. And of course we need legislation, rules, and of course hopefully voluntary-based issues as well.
How about you, Eva? Do you have any complementary thoughts?
Yes, thank you very much. I'm again from the Prime Minister's office, and I'll bring some insights from that perspective. I also want to thank the whole process. It's been really exciting, and I'm really happy that we both committed to each other in this process. And it's difficult now not to refer to any of your presentations or the projects as yet, but they really cover much what is needed. I would add to what Sari was taking up, trust, and trust doesn't come straight away, but trust is extremely important. That I think one part of the silo is this trust, because silos are not always bad. Silos are really good. It's a way to organize actually our society. Now the question is that things are so interlinked, and so we need in a way both be in silos and be between silos and collaborate. So in the sense it's really important. The other thing that I did not maybe hear so much is the leadership and the different leaders, where it was political will there, but political will is a little bit different than actually the leadership and management that takes place, that the support comes from there. Maybe in the formal teams it's involved in there. One thing is the shared vision. One can also say that you could have 2 or 3 kind of shared issues, or shared, maybe even something concrete that you focus on, that brings people together. We know the fact that if we have something shared, even people who are, or countries who are violent to each other, find common ground when there's something that you share. And then mobilization is extremely important, that we don't only plan these wonderful strategies, especially in Finland. This is very something that we tend to fall into, that we develop wonderful, wonderful strategies, but don't take them into practice. And this was very nicely brought up here as well. And awareness raising. We think that everyone thinks the same way or has the same understanding, but we are very far from that.
And I think you're going to have very good discussions with the students, as a lot was about people and how people are the drivers to this change, but also that interlinks very well with this notion of trust, of indicators. Then there are a lot of indicators for policy coherence on a 2030 agenda, so that's something that links very well. So I foresee a lot of good conversations between the two of you ahead. I will jump now to our students, and I would love to hear from you. Maybe we can start from you, Lei. What are maybe 1 or 2 unobvious issues or insights that came up in your groups, and anything that you would want to raise, either about the government or your own area of exploration?
Thank you. Just brief introduction of myself. I'm Lei from the 1A team. We study the horizontal perspective of policy coherence. So I want to add to what Eva just said. The people are the main drivers of the changes. I know it sounds a little bit cliche to saying this, we need more human-centric perspective, but I can explore something from our research. During our research, one of our partners said that they do a tryout within the government. And surprisingly, personally surprising for me, is that people have very high of willingness in participating in their awareness of the bio value, even though they are very, very busy people. So, and also as Alpa just say in our Q&A question part, we think that even though there are so many people, very high willingness in contribution, but sometimes they are like limited by their own sphere. So human-centric, again, is a very important takeaway from our group.
That's a good way to put it. Anu, do you have any thoughts on this?
Yes, again, just a quick introduction. I'm Anu, I'm representing group 1B. Unobvious things, I think the whole government and how policy works itself was like pretty unobvious, or it was a new learning for us. Interestingly, we thought everything would be organized and structured within the ministry, but there's also like informal networks and little coffee breaks that they take, and they discuss such important topics about biodiversity, which we think came up in our interviews or in our research, which is not quite evident or out there, that they discuss such things very informally also, and good discussions arise over there, and then they are not documented, but they're happy to have such chats, and it would be nice to take those chats or discussions forward and like action them out. And I think, yeah, that was fun.
Thank you. Sari, what is missing from these perspectives?
Thank you. Yeah, so Sari from 1C. Kind of looking at the vertical ecosystem, which is the agencies, institutes, service-providing entities. We learned that it's very important that people come together. Like the dialogue is kind of the core in the policy coherence. And we kind of noticed that in some vertical perspective, this has been lost. It's kind of that this dialogue, which has been happening face-to-face on the field, has been pushed up to the politics. And this has led kind of that maybe the agency level or institute level agency has been gone a little bit missing. And like that was maybe for us like really insightful, finding, and kind of to understand that bringing people together to share insights and ideas, not necessarily agreeing, but understanding each other is actually really important, especially in these times of remote work.
Absolutely, thank you so much. Let's end on a strong note. So a big question coming your way now. Given what you've heard and everything that's been happening during these months, what do you think are ideas, insights, opportunities that our groups have presented that might actually help advance actions, agendas in terms of policy coherence for biodiversity?
Yeah, maybe I start. So I think I'll go group by group, and it's been a wonderful process. It's been a process of seeing you grow and seeing us grow and seeing us grow and co-create together. It's been really great. I really want to thank you that you put so much effort on this. And I think there's a lot to learn. There's many things that are familiar, but we haven't taken them forward so much. But they are still there, and this makes it much more concrete. So if I start with the one that is closest to us, which is the agents of change, and actually we've been talking about this in our office now after this process only the last weeks, whether it is a good way or not. And I think you have progressed since we last saw, and I really enjoyed this interplay of formal and informal. And I think that's the crucial one, that you have both of them, because if you have only one, it's either too administrative or then it is too loose, as one of the questions came up here. So I think that really gives you strength. having that. I also enjoyed the element of assessment, and this, even though it's for us as scientists, it is so self-clear, it is something that is still missing very often. So I think that was really important that that was included. Also that the process was written in a concrete way, that this and this and this and this should happen along the way is really important, because if that's not done, then it's often lost. And then also I would just like to say that this getting together and really speaking together in the ministries is important, and many things that everyone has this shared understanding, but when you start to speak, you notice that people still see things in a different way. Then I'll just comment shortly the other ones as well, which are, well, I think the Prime Minister's office should be involved in everything, as you mentioned, that it's the neutral, somehow the neutral element that's included there. And I also very much like this 4-step model of project, where you in a way force, first of all, the ministries are dividing their work into projects, which is kind of way of getting some sense in this very fast-paced job. So it's really important to have some kind of assessment that is going on there. But taking it even further, it is good that it is also then put kind of in a bigger context, that then you look at the whole picture, how it makes sense and how it's then connected at the end. That is really important. I found it a bit technocratic, but because it's done together, I see that the 3 projects are really well matching each other, that you don't manage only with one, you need the 3 of them to support. I don't know if it's Nuria who has kind of made this, but I think that's very good that they are. So that's really important, and that's how I come then to the nature dialogue, which sounds like the softest, but in reality I think you hit a very important point, because I was just having a discussion with a legal professor from Joensuu University, or East Finland University, who really said that in these paradigm shifts, it's not even though the regulation and the legal part and the policies are something that makes things happen, what you really need is for this paradigm change and to make the place available for these changes or policies is actually these different kind of spaces where you have a dialogue. And I think the answer to the last question about this, that if you don't have them in your office, then you need to bring them from outside to be able to talk. So thanks once more to the work, and we are looking forward to the final reports. We will take that then to the next level.
Thank you, Eva. Sorry, I see you smiling, like I want to comment something. Do you have anything to add?
Okay, yes, thanks. Thanks, Eva. I do agree with you. And yes, I want to add that I was really, I don't want to say surprised, but still amazed how well you have proceeded from the starting point, or at least from the previous meeting. All of your presentations were great. I think Ministry of Environment is more in the group 2, but I think we are participating with all of those groups. So I was really liking this idea network path links strategy point of view in the first group, and there was so much information. I'm trying to read my notes, but they are not very clear. But yes, I did like that a lot. And in group 2 about the matrix and having a steering group, it was really amazing and nice point of view which we need to do in the Ministry of Environment. And the Russian Doll and Nature Dialogue core group, and these are all also very important in Group 3. And yes, we will use these end reports. That's why I was smiling, because we are planning, if it's okay, are they all open reports? Are we able to use and spread them? So we are planning now with Rita that we will take your reports whenever they are finished, and we try to utilize them as well as we can. And of course we will have cooperation with other ministries, especially with Eva and Christina, and try to figure out what we can do with those reports, as you have pointed out that we have issues and you have nice solutions from them. So I'm really happy to have those reports in a couple of weeks, and all the best for you students. You are a great group of young people. So yes, we will utilize them. Thanks.
Thank you. I think that is a perfect closure to our panel. Not much more I can say, so thank you very much.
All right. So I'm going to just say a few opening words about our theme. We've gone from biodiversity, which was the first one, and we're going to now shift to healthcare issues, and we're going to talk about continuity of care. Let me just see here, sorry. We have, I think probably most people are aware, probably not just the Finnish problem, but that whole concept of healthcare delivery is under a lot of pressure and requires sort of reconsideration. What does care look like? And one of the things that our partners, Kela, I'm going to get the English versions of these wrong, so I actually have to, I made notes just to make sure I don't butcher our partners' names. So Kela, which I believe translates roughly into the Finnish Social Security Institute, is one of our partners. We're in their beautiful spaces today. We also have the Ministry of Social Affairs and Health, and then the Western Uusimaa Wellbeing Service County that is also piloting some of these ideas. So we've been working on them. And this basic idea of having continuity in care maybe seems quite obvious, but the systems we currently have don't necessarily always enable that. And the idea that has been sort of maturing is one of having your own doctor, oma lääkäri. And so when we talk about continuity of care, how do you have a relationship that is sustained over time? What are the systems that are necessary to make that happen? What does that mean from different perspectives? We'll have 3 groups. Each one, as in the first sort of set, have a different perspective. If you think about this issue, there's at least 3 actors, and these are the 3 actors I think we'll hear from. One is clearly the patient perspective. How do we think about continuity of care from that perspective? Another one is the doctor's perspective. And then the third one is the administrative perspective. And we're going to try to see how these 3 perspectives have generated a set of propositions. I believe it's time for me just to be quiet right here. We have our first group that will come up here, and they will also introduce the shared vision that the 3 groups have built for what continuity of care in Finland means. So why don't you join me in giving a great round of applause for these fantastic students.
Okay, hello everyone, and welcome also on my behalf to the second part of the day. With the 3 groups, we have devised a super group vision, which reads, we provide a trustworthy and sustainable healthcare system that fosters collaborative and meaningful care for patients and staff in a society where everyone feels cared for. Now, each group has taken a different perspective towards this vision, and our group has been working from the patient perspective. We are Heidi, Robert, Devyani, and Sophia. From sick care to healthcare. But what does this sick care mean? In one interview with a doctor, we got this term which has stuck with us through our process. Sick care means a system which is overburdened, it has no capacity for prevention, and there is a lack of trust between patients and healthcare staff. On the other side, a healthcare system ideally has more capacity, which means more time for preventive care. It has better overview of super users, and these super users mean people with complex issues that have to go to healthcare services more often than the average. There is also increased trust and cooperation between patients and healthcare staff. Sometimes I think that the doctors are not feeling they are dealing with human lives, but only with sickness. This is a quote from a patient with a chronic illness, aged 22. On the other side, also the staff are feeling this strain on the system. There are no health checkups, it's usually a sickness checkup. It's not health work, it's sick work. We visualize the health center as a green circle with the different actors inside, so doctors, nurses, and allied health professionals. On the outside here we have the patients who are connected to random nurses and through them to random doctors on each visit. The patient has a ping-pong role. Going from one professional to another is how one general practitioner and researcher at Tampere University described the role of the patient within the system to us. The patient must repeat their medical history over and over again due to this fragmentation in their care. Also, on the wider scale of the patient's lifespan, there are continuously the system changes from different public services and then to private services and back again. And these transitions can be disruptive and lead to discontinuity of care. Continuity of care, for us, meaning a cohesive patient journey that allows for a broader overview of the patient's health. Now, going more deep into the health centers form a diverse landscape. First of all, they vary in size. For example, one general practitioner who we interviewed had worked as a chief physician at a health center with 30 general practitioners within it, and the smaller health center would have some 5 GPs, and then everything in between, depending on where the health center is located in Finland. Additionally, health centers have different structures and ways of working. So, for example, a health center may utilize a team model, or they may have more individual working mode. Also, the different digital platforms will vary between different well-being services counties. This flexibility is actually a very big strength of the health centers, because different areas have different demographics and they must be tailored to accordingly. For example, in one area there may be more elderly population, or some chronic illness may be more prominent, and there the health center must meet the need of these patients. Now, looking at different practices which already exist in some health centers, there are ways of working which support continuity of care and which are already being utilized in Finland. These include, for example, healthcare teams which are in place in some areas, and this enables the patient to have a bigger chance of seeing the same doctor between different visits. Also, in northern Ostrobothnia and Lapland, they are moving in the direction of personal nurse and/or doctor. So we know that these best practices exist, but how can they be shared between health centers, streamlining all health centers towards more continuity of care?
All right, so to bridge this gap between the current system and the future system with more continuity of care, we are proposing a strategic action plan. So we envision the action plan to be a transitional process with different levels, which will move the healthcare system closer to our vision with more continuity of care. So the first level in the action plan is teams of care. By this, we mean creating different healthcare teams within the health center, comprising of doctors, nurses, and other allied health professionals. These teams can be built upon existing team structures within the healthcare system, or they could be created to provide continuity of care to a certain group of patients. So in this way, the patients will have continuity of care with their teams of care, and hence they are more likely to see the same doctors during their visits. This will also encourage patients to take more accountability of their health. The patients will have consistent familiarity during their visits, which will promote feelings of care and security, and also increases the trust in their system. From the doctor's perspective, working in teams gives them better support and collaboration. They can exchange information within their teams about their patient progress, and this will make their work more meaningful and enhance their satisfaction. There are many benefits to working in teams. Quoting from our research here, many of the issues being taken care of in the healthcare centers need specific expertise. One doctor cannot manage all the information and is not the best professional in all situations. So working in teams can greatly reduce the pressure on the doctors and nurses. The next level in our action plan is continuity on demand. And by this we mean when a patient visits a doctor in their healthcare team, the doctor can decide to offer follow-up appointments to the patient to monitor their progress throughout the treatment. And this is decided with the patient when it's required. Then both the patient and the doctor can discuss together the number of appointments and the duration of the treatment. The booking system can be adapted to facilitate these follow-up visits with the doctor for the select patients without much hassle. So this system provides continuity of care to the patients when they need it and for the people who need it the most. The third level in the action plan is assigning personal doctors to the super users. From our research, we found that 81% of the healthcare and social sector resources are consumed by only 10% of the population. We call this 10% the super users. We propose to provide a personal doctor to these super users so that they are always being taken care of by the same doctor. By addressing this 10% of the population, we are providing continuity of care to them. We are addressing a large portion of the healthcare system. This will reduce the consultation times as the frequent users have better relationship with their doctor and hence improving the efficiency of the system. This will free up capacity and reduce the pressure on the doctors, and hence they can provide better care for everyone. So this is our action plan again with the 3 levels, and we aim to achieve a model of continuity of care that is flexible and it caters to the different needs of the patients. And now we will talk about how we propose to realize this action plan in practice.
Hope it works now. Yeah, let's imagine we finally hold this action plan in our hands, and we want it then to be distributed among the different well-being services counties. There are 22. And after that, each of those well-being service counties will recruit a task force which is equipped with our action plan. Why a task force? Because we found in our research that the health centers are already so overburdened, so they cannot really think about transforming on their own. So this task force then goes to the health centers, an average 6 per well-being region, is helping with the evaluation and implementation. For the evaluation, we imagine both KPIs, which allows us to get a more factual understanding of where the health centers are, but most importantly, feedback from the patients and the staff, because we found that oftentimes the administrative structure of the health center does not reflect how the staff actually feels working in the center. And again, for the patients we saw, as Devayani presented, the needs are varying greatly. So we need this feedback from patients and staff to actually see where the health care in Finland is going. And then we have action, which means changes in the health center, so in its functioning, and also in the public communication, because oftentimes the patients don't really know how the respective health center is working. There's a general lack of information. So this is why it's part of our action plan. And those 2 steps can be repeated over and over to bring us closer to our vision. Let's talk about one health center in Lahti for an experiment. We talked with a junior doctor which worked in this health center, and we think it's an interesting example to illustrate how our action plan works. So in his case, actually, all of the patients were already assigned to teams. But when we asked him about the experience, the feedback loop I talked about earlier, he said that his work mode did not differ greatly from when he worked in the individualistic working model. And also we were lacking the data from the patients, how they felt about this team model. And of course we have some unknowns, but let's just put his health center in our spectrum here to give a starting point for the different actions we can take. So for this specific phase, we now have the changes in the health center, and we've heard that they already assigned patients to care teams, but they did not make sure that those teams are not just in administrative groups, but are actually working together to provide better healthcare for the patients. And furthermore, they did not really exploit the existing features of the building to make sure that it can better accommodate the teamwork. Also, the patients were only informed about the number they were supposed to call, but not about the fact that they're now part of a care team. And therefore, we propose both to use the on-site information spreading, but also via push notification in Kanta or letters home. This general evaluation of health centers with those different phases allows us in a later stage to get an overview of where Finland is at. We can compare different health centers in terms of size and see how the health centers may be evolving in the future. We can point out pilot projects that maybe have a different way of working, and then in the next stage also create exchange between those pilot projects and similar sized health centers to make sure that they will accomplish this goal of more continuity of care. And ultimately, the teams which have completed our action plan, they can report back, they can transform the action plan itself to make sure that the teams which currently start with the action plan follow the right actions.
But why this is actually important now? Kela is currently developing a new patient reimbursement model proposal for 2025. As stated by Kela, this patient reimbursement model will improve access to healthcare services by reimbursing patients for visits to both the public and the private health centers. If we apply this patient reimbursement model to our visualization of the health centers that we saw before, we see that the patients, through this reimbursement model, will be able to use more the private sector, and by this reduce the pressure on the public centers. We see this situation as a good opportunity to work on the health centers, on the public health centers, to restructure and develop them with more long-term results. So Kela can support this by reimbursing the interventions of the action plan. If we take back the example that Robert said before, we can see that Kela could invest and reimburse, for example, the in-work team training activity that the task force is facilitating in the action plan. So through this intervention, each health center will have the flexibility to evolve at its own pace, but within a shared framework and towards a common goal. In conclusion, through this adaptable and evolving action plan, we want to shift from this sick care system that we mentioned at the beginning, where all patients are visiting different health professionals only when they are sick and acting more as customer more than patients, to a healthcare system where patients are assigned to health professionals like health team and that continuously take care of them. And in this approach, we will improve the healthcare system level and also the patient experience and outcome. Thank you.
I got to speak low. No, okay, hold on. All right, thank you. That was great. Any questions? Anything, anybody? This gentleman up here.
So the frequency of visiting the same doctor, is it any geographical challenges? Like I'm in the big cities, can the frequency can be increased? Because I see it's in Rovaniemi is quite frequent. That's a possibility. So can you use AI models or data science, and then you could map it and cluster the things so that like you'll be, ramp up the thing and it will be more effective? Thank you.
Yeah, I think there are several layers to your question. First of all, you pointed out that the health centers are more and more centralized and they're moving further away from people. That is indeed a problem. There is an increase in online consultations, not AI yet, but where you see a doctor in an online format, and those can help with those issues. But I think on the long term, it's still very important that you actually consult a doctor and that you see the same doctor. We found, though, in our research that the patients who need the continuity the most, those are not the patients which move around in the country a lot. So actually, with this focus on the super users, with the continuity on demand, we would mostly focus on people which are stationary to some extent. Does this answer your question? Does this answer your question? Okay, thank you.
I forgot to mention, so if you want to put comments, use the code over here. Anything else? Anybody? That's a hand up there.
Thank you for your presentation, and I found that you have noticed a lot of problem in the healthcare center. And I just want to ask, because it looked like you changed the system quite a lot. So have you think about how long would it be to change to the new kind of system like this, like changing the model and so on?
Yeah, I think, of course, it will take some time, and that's why also there are the different levels. So the idea is really to have an evolving action plan that is also like evolving during the time, and thanks to the different health centers that are working and going through the action plan. So we have now not define a specific timeline, but I think it's also because of the idea that it's based on each health center will take different time, because of course a bigger health center will take more time than a very small health center to make all these changes. But thank you for the question.
All right, great. Thank you very much. Please join me in giving these guys a great round of applause. All right, our next group. Oh, no, it's okay. Come on up. I'm just going to pass this over to you. And help me in welcome Linda.
Dear patients, have you ever felt alone throughout your care journey? We did not hire all these people, I can assure you. Dear doctors, do you feel that you don't see the results of your work? Well, I was not expecting, but so many answers, but that's great. So we believe that this is due to the roadblock created by lack of continuity of care. So my name is Sofia. Here with me I have David and Bhairavi, and Thomas is joining later on in the panel. So in the past 2 months, we have been working in our project called Co-Innovate that intends to improve continuity of care in the Finnish healthcare system. But why are we talking about continuity of care now? If we look at this graphic from Numela Healthcare Center, we understand that 15% of annual patient contacts create 48% of workload. And we also know that this subgroup is composed by old people with chronic disease. So it's only natural that these people need more attention from the medical staff. And we also know that this group is only going to increase because Finland is among the world's fastest aging populations. So if this subgroup will increase, it will create an unmanageable workload for the medical staff. And in a system that lacks continuity of care, and that promotes unnecessary appointments, this will create a lot of costs. So we need to act now. Okay, so we established that continuity of care is indeed very important,
But what does it really mean for general practitioners? How is it to work in the system that lacks continuity of care? To answer these questions, we interviewed 6 general practitioners. And one of them was telling us how continuity of care is important for the patient, but also for the physician. And he ended up saying that it's always acute diseases and never long-term relationships. I don't want to work like this. So the truth is, we will not achieve continuity of care if doctors and medical staff are not satisfied. So our group looked into the medical staff perspective, more specifically into the working conditions of general practitioners, and we found 4 main pain points: excessive administrative tasks, lack of time and flexibility, unmet working skills, and finally, lack of sense of meaning. And we understood that these problems were correlated, so they don't exist in solitude, and we wanted to understand the dynamics between them, so we tried to map them out. And we understood that a central problem is not having feedback that is directly correlated to lack of sense of meaning. And this puts a lot into question, right? So we understood that this area hinders continuity of care significantly, and we need to act here. But how can we change this? Well, the answer is follow-up culture. And in this way, we will flatten the roadblock towards continuity of care. But what do I mean when I say follow-up? So follow-up is maintaining communication and check-ins with patients after their initial treatment. It fosters communication and trust, acts as preventive method, and improves patient outcome. Okay, we understand what follow-up is, but how can we create this culture? What are the ingredients that we need? First, we have visibility. And by visibility, I mean direct and concise communication with patients. Communication inside the team, sharing outcomes inside and outside organizations. Secondly, motivation. We need a motivated team committed to innovation, to collaborate, and to share decision-making processes. And finally, we have habits. And by habits, we mean practices and routines, beliefs and values. But what are the habits that compose follow-up in Finland, since it's not established? And how can we establish these habits across healthcare centers? We know that there is little time and funding. Healthcare centers are different in strategies, size, and demographics. And the Finnish healthcare system is focusing on delivering services and not continuous care throughout the full care cycle. So we don't really know what these habits are, but we do know that if we work towards visibility and motivation, we will achieve it. Michael Porter, a renowned economist that has a vast research on how to improve healthcare systems, said, teams improve and excel by tracking progress over time and comparing their performance to that of peers inside and outside their organization. So, taking on that, we want to present you the Kela Co-Innovation Program that my colleague David will present further.
Thank you, Sophia. So, how can Kela actually help healthcare centers to improve their own follow-up culture? And our proposal also has 4 steps. The first is a call for innovation. Then we send the healthcare centers to an innovation camp. And then we have an implementation phase and an adoption phase. And point 1 and point 4 will happen like publicly inside the primary care system, whereas the point 2 and point 3 will happen in a selected group of healthcare centers that are the so-called innovation hub, and they're like selected during the process that we will see later on. But first we have to ask the question, why do we think an approach like this is helpful? And we have seen that Nesta, which is the British equivalent of Citra, has run a very similar program which is called Creative Councils, and they focused on building new innovation capacity in public councils inside the UK. And we took this project kind of a bit as a reference for our approach of fostering follow-up culture in Finland. So, but let's unpack where like the call for innovation. So what happens in the first step? The first step is that Kela will send out a brief to health centers across Finland to let them start like innovating on their own follow-up culture, with the goal that they will create a proposal on how they will implement follow-up culture inside the healthcare center. And what does this brief contain? For once, what do we innovate for? That is like the follow-up culture, and also it will contain the previously seen definition of follow-up culture, but it also will have assessment areas that we need to track, and we need to track the value that is created for patients through this follow-up culture, but also for doctors. And the fourth point is the Kela funding, and that is a very important part of this proposal, because we have to ask the question, why would healthcare centers participate in this? Because they already are backed up with work and have very limited resources. So one part would be that we provide the funding for them to actually implement ideas that they have that will improve the follow-up culture. And we will also provide them with expertise and guidance throughout the implementation process and their innovation processes. But in this step, we can also consider to actually get additional funding, for example, from organizations like the Kondo Foundation, and we can also imagine that other like organizations like Citra will actually help us with fostering these innovation processes inside the healthcare centers. So the next step is that the interested healthcare centers will send a proposal back to Kela, and we will select the proposals for the innovation camp. And how do we select them? We look at the characteristics of the healthcare center, so like differences in geographic locations, but also differences in demographics. But we will also look at how like innovative or motivated the proposal actually is, and also how viable or feasible this proposal will be. And then they will get an invitation to join the innovation camp. And in the innovation camp, members of the healthcare center team, together with their coordinator and guests they have invited, like, for example, local politicians in their welfare counties, county officials, and maybe even like some patients there, will come together and join with the other selected teams in this innovation camp that is run by Kela and Citra. And this camp is really focusing on creating a co-learning experiences for the team, because we don't know what this follow-up culture is really, and we need to refine the proposals. And it also includes like coaching sessions on how can we actually like create more change inside the system together with Kela and Citra. And another aspect of it is that we connect the teams, we create the space for networking and also for pitching like different approaches and ideas in between these participating healthcare teams. And after that, we like hopefully have refined proposals, and then Kela will go on and select the centers that will actually be funded in, they will actually be funding in the implementation phase. And we can go about this in 3 different ways. We can select a very low amount of healthcare centers that are still kind of comparable in size and demographics, and maybe have one that is like vastly different. We can go for like political representation, so we have one healthcare center out of each collaborative areas in Finland, or we can create like an even greater network, which has the advantage that we will probably create way more perspectives and way more like interesting and varying outcomes. And after that, we will see how this implementation in the healthcare centers work, and that is what Bhairavi will explain to you now.
Thank you so much, David. So now we are in the implementation phase, and let's go back to the health centers and see what's happening. After the innovation camp, teams come back to their health centers with their innovation plans, and they look further into implementing them. The steps decided in the innovation camp are implemented into the workplace. These can be actions such as scheduling follow-up calls, checking on life quality surveys, but these are just examples, and the opportunities are endless. A while after these actions have been implemented, it is important to assess them at timely intervals. While assessing these actions, it is essential to focus on the value created for patients and the value created for medical staff. The actions which are implemented are then discussed within internal groups, and they are also discussed within the innovation groups. This is done to push learning, to gain feedback, and maintain a community. Kela will also be a part of these meetings, so they are constantly involved and know what is happening. So now that we have implemented and assessed these actions, the next step is to adopt them into various health centers and set a new standard. So once an outcome is established, it is publicly reported. And ta-da! We not only help integrate innovation in public health centers, but also this report will set a new standard on how to integrate follow-up culture in Finnish public healthcare centers. To summarize, we began with understanding continuity of care, especially from the doctor's perspective, and we realized that in order to create a sense of meaning in the doctor's work, it is necessary to implement a follow-up culture. This led to a call for innovation where different health centers in Finland are encouraged to ideate towards creating this follow-up culture. These ideas are further discussed in the innovation camps, which act as a space to connect other stakeholders as well as teams from the health centers. Once these teams go back to their health centers, they implement, assess, and discuss these ideas. And after assessing them and creating a report, this is adopted into other health centers and a new standard is created. Our program encourages sharing outcomes, fosters positive feedback, and creates a network between different healthcare centers and provides room to generate innovative solutions. And look, the roadblock has gone. Thank you so much.
Great, thank you. Any questions, thoughts, reflections for the team? Anything tickle you? There's a gentleman in the back. Oh, in the front.
Oh. Yes. Is it? Okay, thank you. Very, very interesting. I'm Janne Mattila from Kela. I mean, curious. It's very exciting to see the process. Have you from the beginning where you ended up? Curious to hear a bit more about the sort of when you ended up in the idea of follow-up culture, how you then went to the path of innovation camps and so on. What sort of other options? What was your sort of thinking at that point? Because that's really out of the box. Me being from innovation unit, of course, that's interesting, but in terms of applying that as a solution, it's interesting. That's where you ended up.
Yeah. So we thought about this follow-up culture as kind of the remedy for the problems that we discussed, but we realized that the healthcare centers are so different that we cannot find a solution that is applicable to all of them. So the only real way to do it is to have all the healthcare centers. The solution is to have the healthcare centers come up with their own plan and then implement that. So then the role is not to make a plan that they can implement, but let them do it themselves. And that's how we came to that solution. Did that answer your question? Yeah, thank you. If I stand perfectly still, you can still ask a question.
Yeah, I was wondering, because now you also proposed a sort of competition between the health centers, and I was thinking in which way this is again.
Yeah, I think the answer to that is that doctors are competitive. So you cannot really take the competitiveness out of doctors, but we can at least use it to foster a sort of positive competition. And that's what we aim to do with our solution. And to be fully honest with you, like about the competition with private sector, that's something that we haven't really focused on since our focus has mainly been on the public. Thank you.
All right, while the mic seems to be working, I'm gonna ask you to join me in welcoming the last but not least, oh, something I said? We're having a bit of a problem with the sound here. So maybe if you can stand by, and if it happens, then we can figure it out. Anyhow, great round of applause for our last but not least team.
I would like to invite you to imagine a symphony orchestra like the one we have just listened to. So within the symphony orchestra, each musician plays a crucial role, from violinist to cellist and to the flautist. So if one of those musicians were absent, or they were asked to do tasks other than their expertise, then the harmony will be disrupted and the performance will suffer. So I would like to now think of it in a different way. Whereas the musicians are the medical staff, and then the harmony is the patient care. So today, we would like to talk about the harmony of continuity of care and how each medical staff can actually achieve better continuity within the healthcare system. So this is our proposal, Care for Care. And throughout the project, we've been focusing the continuity of care from an administrative perspective. And this is our team. This is Beste, Tekla, Atte, and Emma will be joining in the panel discussion after the presentation. So I would like to briefly start with giving the context, and then we will transition through our proposal and our implementation steps and future vision. So to start with the context, actually we were trying to understand the core problems within the system. So we realized that actually within the recent years, doctors and medical staff have been experiencing a lot of work pressure and little control over their work. Even within 6 years of time frame, it has increased more than doubled. So we were trying to understand what might be the reasons for creating this work pressure. Here we can see a medical team consisting of doctors, nurses, and support staff. That's how it used to be. However, within the time, due to need of cost cuts, some of the support staff have been laid off. And it has backfired, creating more workload for other medical staff and having more non-medical tasks that have been assigned to them, which ended up creating this stress on them. Consequently, within the system, some of the medical staff decided to switch to private sector, or they decided to switch from full-time to work part-time because of all this workload. From another perspective, together with all the developments happening in the healthcare system, the Finnish demographics are changing. So we project that within the future, even though the amount of general practitioners working in public doesn't seem to be increasing drastically, the demand of care is looking so. So we see the threat of unmet demand increasing drastically within the primary healthcare services. So what can be done to actually face all of these challenges and provide better continuity of care within the Finnish healthcare system?
Thank you, Beste. So looking at this, like the easiest, the more like intuitive idea might be, okay, let's just hire more doctors, admit more medical students, and they will close this gap. But the problem is not necessarily like primarily the amount of doctors, but it is the amount of patient-doctor time. As this quote, that's gonna come now, by Dr. Laura Juvonen puts it, even if we got 1,000 new doctors tomorrow, I don't think it would lead to lasting results unless we change our practice. So with the workload that doctors and nurses are facing today, we think it is impossible to expect of them to provide holistic care. They're trained to tasks that they're not trained for, that are not in their expertise, that they did not sign up for when they decided to become a doctor or nurse. And it just leaves them stressed and frustrated. So we're proposing a team-based approach to care that will make sure that everyone can do the stuff that they're good at within a team, that they can show their strengths. And with this, we're not only going to raise job satisfaction, but we're also going to increase efficiency. So we started looking into a schedule of a doctor. This is obviously varying from health center to health center, from doctor to doctor. This is a simplified visualization. But with this one, a doctor can currently see 9 patients in a day, which is not a lot. But it is due to the fact that they spend a lot of their time with non-medical tasks. So for the 30 minutes that are blocked for one patient, they're only actually like talking and engaging with the patient for 8 minutes. And the rest of the time is spent with things like preparing the room, filling out forms, updating medical records. And we see a very similar thing happening in the nurse's schedule. So for example, they are spending a lot of time ordering and restocking medical supplies. They're booking and scheduling appointments. Interviews, we heard of nurses, like cleaning the fridges and the common lunchrooms. We heard of doctors spending 20 minutes just like looking for the paper for the printer. And looking at both of these schedules, we were thinking that's quite an inefficient use of resources, of time and of money. So we started thinking, what if we had a team-based approach? What if there were people that could support the doctors and the nurses? Because from other countries, for example, Germany, we know that there is, for example, someone preparing the room. There was someone helping with filling out forms. There is someone like basically keeping the workspace itself running so that the medical staff can concentrate on medical tasks. So just looking at these things, maybe that could be a medical office administrator. Maybe that could be an AI that makes it easier to fill out these forms, an AI that could maybe like interpret medical records. And with that, like maybe ease the workload out of the medical staff. Because now if we go back to the schedule of the doctor and the nurse, we see a lot of time is open up for them. They can now see 15 patients in a day, which is almost double the amount of patients. They also have almost double the amount of time talking to the patient or engaging with the patient. And we see a very similar thing. In the nurse's schedule, they now have a lot more time for patient care. So for example, they can do a pre-examination, they could guide them through their treatment, and with that, build a stronger and a more trustful relationship with the nurse, with the patient. So now the big question, obviously, is what would that kind of a team look like in detail? Like who would be a member of this team? And so I'm now going to give it to Atte.
Okay, to test our proposal and how such a team would look like, we propose implementing a pilot program called Symphony. In this pilot, we would focus on area that reflects the state of Finland in 10 years. This means aging demographics and variable demand for healthcare services. Area for this pilot could be, for example, Hanko. The plan is to invite staff from Hanko Healthcare Center to participate in this pilot. The local medical director, along with the external consultant, will be recruiting the healthcare professionals. These professionals could include nurses, doctors, medical administrator, team assistant, or AI assistant. From these professionals, medical director and consultant will decide the different team structures. The list of individual tasks will be made to create well-balanced work description for everyone in this pilot. We want to use this pilot to experiment different team composition, determine which one works the best. So instead of simply passing and failing, we want the pilot to be dynamic and continue improving until we found the best solution. Therefore, we aim to incorporate ongoing feedback cycles to ensure constant learning and development. Finland has diverse needs for patient care due to its varying population in different regions. So one model won't cover the whole Finland. Our next step would be to approach different locations in Finland. Again, with ongoing feedback cycles to make sure the model is perfect fit for every region. The pilot and its implementation will require resources in the beginning. New personnel need to be hired, trained, and integrated to form a team. The public sector will be able to take more of patient and will also reduce the outsourced care from the private sector, which will reduce the cost in the long run. With this team-based approach, we trust that we can increase job satisfaction, which can prevent doctors switching to private sector or working part-time. Patients will have more time with their doctor, and ultimately this way we will have primary care system consisting passionate and purpose-driven professionals who are able to provide outstanding continuity of the care. Our future vision is to raise a new generation of medical professionals who naturally adopt this collaboration system. To achieve this, we must begin from the foundation. During the education, doctor and nursing students should taught effective collaboration skills. We propose joint classes where future medical staff can get familiarized with each other to prevent development of hierarchies within the public medical sector.
So yes, as we have covered our proposal, including different steps within the future vision, we believe that all of those will actually lead to our bigger vision, which is providing trustworthy and sustainable healthcare that will foster collaborative and meaningful care for all. And we believe that these are the first notes within our symphony of continuity of care that will lead bigger harmony in the end. So now we can think back to our orchestra, and I would like to say that let's have a healthcare center where everyone, healthcare system where everyone feels cared for, and where all patients and healthcare staff can thrive in harmony. So thank you for listening to us.
All right. Any questions for the team? Any thoughts, reflection? We have a question here. This is going to be awkward. I'm going to pass you this.
Okay. I was wondering, because you're talking, firstly, thank you for a wonderful presentation. You spoke of this medical office administration or these external consultants that would be added to these kind of teams that work together. Have you thought of like what target group might fill this role? Like you spoke of a new generation of medical professionals. Does that mean that this could be maybe young professionals that enter this role? What kind of a training or background might be needed? Or is the in-house training enough to fulfill this role in the long term? Have you discussed this as a team?
So first about the young generation that we're planning, I think that's mostly really doctors and nurses. I feel like from experience and hearing a lot of stories, I think what that mostly should be preventing is these strong hierarchies that exist within the medical sector, kind of the doctor being above everything and then everyone else kind of being under it. And I feel for a team-based care, what's needed is low hierarchies and everyone respecting each other. For the kind of a profile of who that person might be, I think it would definitely have to be someone who has some touch points with medical training, because obviously if you work in a health center, you need to know how different routines are going to really actually support a doctor and a nurse and not holding them back. I think like in the beginning, we were really often talking about like a secretary, like really like someone who like books the schedule, like really like kind of takes care of this workspace. But we were feeling like more and more uncomfortable with naming it that, because I feel like it would be so much more. I don't think like it would necessarily have to be like a young generation. I feel like it could be anyone who's interested in a new challenge and who would like to do that. So I don't think it's necessarily like a specific target group. I think it's just anyone who likes to work in a health center. Do you want to add something?
If I can add quickly something, it's also that people who have been working in this field for longer have this like kind of these barriers, or like they have this set mindset of how things are and maybe should be done. But then if we focus also on like the younger generations, or the ones who are going to school and are in this mindset of learning, it would be easier to implement this new like low hierarchy. But for sure, there are also professionals who are willing, like have been working in the field for long and are willing to have this change happen. So.
I'm going to ask you to give a great round of applause to this team. And Carlota, you want to, so we're going to get the panelists up here. If I can get a quick hand here. Thank you. Voila. So we could have maybe our 3 student groups to my right. I'm going to sit here in the middle. And then Veli-Pekka and Rita, if you want to join. We need 2 more chairs for our guests. Where's the other fake mic? Is it behind the stand?
Yeah.
All right. Super. So Tuomas, Emma, Robert from the 3 groups. And then we have Rita from Kela, and then Veli-Pekka from Länsi-Uusimaa, Western, yeah, whatever. Forgive me. So I'm going to give maybe the fake mic to you guys, and I would ask all panelists if we can try to speak a bit loudly so people in the back can hear as well. Maybe the same kind of maybe set of reflections would be interesting as we had with the previous group. Sort of maybe putting aside what we've heard from the students for just a minute, if you take a step back from what's happening in Finland, what do you think are the big sort of strategic questions? How should we think about the agenda of reform around continuity of care? And maybe Veli-Pekka, if you want to get us started.
Yes, thank you so much. I'm Veli-Pekka Puurunen. I'm the Chief Administrative Medical Officer in Länsi-Uudenmaan hyvinvointialue, Western Uusimaa Wellbeing Services County. Well, first of all, thank you for all the presentation. I will give more praise later when we get on to the presentations. But how I see it, the big strategic questions at the moment is that we have strong scientific evidence that continuity of care really increases the quality of care and can help prevent, for example, hospitalizations for acute exacerbations of illnesses. And it has been quite well studied in similar societies such as Norway, and we believe in that strongly. And we need to foster that, we need to advance continuity of care in primary health care. But the fact is that continuity requires stability in the workforce. So we really have to do what we can to make our professionals come to work in our system and to stay for a long time. So the workflow must be good. The work must feel efficient and rewarding, and the employees have to be happy to work there. So in that way we can maybe turn the current vicious cycle into a positive vortex of gravitation towards the public healthcare system. And I think all of the teams, you really your action plans really were the kind that would increase, for example, employer satisfaction, increase efficacy, make the workflow more flowing, and really I congratulate you.
Great, thanks. Rita, what are your reflections in this regard?
Yes, thank you. I will partly repeat what Veli-Pekka just said. So I'm Riitta Luoto from Kela, working here in a Kela research unit as a medical director, and I'm very sorry about these voice problems here, but instead we just try to get along with that. But I had the points of, I think that's 3 strategic questions to solve, and these 3 points, like Alexander Stubb, you have perhaps heard. The first is, which I think you covered perfectly in your presentations, was that first is that there's a lack of economic resources. There's a sort of recession going on, from which we are slightly getting over. And secondly, there's a lack of personnel in the healthcare, and especially in public healthcare. And thirdly, there's lack of energy and lack of trust, and that comes from lots of political disagreement, which you may have noticed, even if you may not read the Finnish newspapers. I think these 3 points are important to solve in somehow, and especially the last one, the energy, to solve this and to meet some kind of understanding that if we don't succeed in this task, I think it's very bad for the whole country, because this is a small country and we all need to feel well. Thanks.
Great. Those are very, very helpful sort of big picture things. But maybe turning back to the student groups, and maybe we could start with you, Tuomas, is maybe a quick reflection on what was unusual in either the theme or working in this topic of government, or maybe reflections that you'd like to highlight.
Yeah, we have one reflection that is maybe on the issues in healthcare, which is a little bit off the topic of your question maybe, but we discussed this in the group yesterday, and we were talking about the healthcare services, and I think the emphasis needs to be really on the word services, because it is run as a service with a service culture, that the patient goes in to see the doctor for a limited time and goes out, and even though there's vast differences in illnesses, they're all kind of treated the same, that it's like in and out. And following this, what is measured is the financial side, but also the time per doctor. And for me, this is a little bit in contrast to continuity of care, because if you want to have continuity of care, but you're measuring something that can't lead to continuity of care, it's very different. So for me, it's like if you want to win a game of Monopoly, but you're collecting Uno reverse cards, like it's not going to get you to win the game of Monopoly. So I think that we need to have new measurements for what is the success for the healthcare industry, and those are really based on, the measurements are really based on value-based care. And once you can measure those things, you can also improve them. So that was our reflection.
Great, thank you, Tuomas. Emma.
Super good points. We had these as well in a similar way. But to add on to that different point, we were thinking for us mostly about the language that we need to speak to understand each other in a way, and how to like convince or prove a point. Coming back to the example, for example, of the team structures, and how a lot of different team structures have been tried before, and for some reason worked or didn't work. And when realizing, for example, that one team structure had been aborted, but that's for now, the time being, it would bring some benefits. For example, we have to, in a way, speak the same language as of pointing out why it didn't work in the future, why it can work now, and taking into account the reasons why it didn't work in the future, to have it, like, to take them into account into today's proposal. So it's a lot into like looking into the same details and having kind of putting ourselves in the shoes of our partners and understanding what they want and what they can win that's important to them in our proposal.
Mm-hmm. Yep, very, very useful. Maybe not throwing the baby with the bath water, so to speak. Robert, what are your reflections?
Yeah, I wanted to sort of connect to what Thomas said, because our initial starting point of this project was actually the patient's perspective, even though we now presented something that was highly on the system level. And I think if we really go into our vision of healthcare, we're not even talking about healthcare anymore, because people live a life that is allowing them to not even go to the doctor. And I think this is really a crucial part of this whole debate. How can we actually start in other areas of politics to create behaviors which make people live a healthier life? And for me, it's really interesting to see what could doctors look like in this future. Do we have doctors which are more like health buddies, which educate you on your health instead of just treating your illnesses? Because I think that health should not be like a service that you just buy in this customer kind of dynamic, but health is your own duty. And yeah, how can we create a system that puts the people back into the driver's seat?
Great. Thank you. Those were very, very useful. I'm going to go back to our partners, maybe for a reflection, if you don't mind, perhaps connecting some of the things you think need to happen, but having heard what the students have proposed, what are some of the things you would highlight, or some of the ideas that you thought are worth maybe building on? And maybe we start with you again, Veli-Pekka.
Yes, thank you. Well, now when we talk about your group's work, I have to congratulate you. I have been truly astonished, both during the course and now in the final presentations, how you've been able to grasp the very, very complex Finnish system in such a short time period while doing other courses. And you've also found really, really great new, fresh insights into this great conundrum that we have when we try to increase access to healthcare and continuity of care there. I have to say I liked the vision. I think the vision was joint vision for all groups, that you want to provide a trustworthy and sustainable healthcare system that fosters collaborative and meaningful care for patients and staff in a society where everyone feels cared for. When I first saw the vision, I was really moved because it's a really, really beautiful vision, and it's something that we need to work towards. But well, Rita already mentioned the economical challenges we are facing in Finland, and they are true. We would need more professionals in the public healthcare system, especially specialists in general practice, so experienced general practitioners, and we also will need the financial means to hire if they want to come. So that's really something we need also to increase continuity. So for a single doctor or a professional or a team, the population must not be too big, so it becomes untenable. And what I thought was wonderful in all of your presentations, that you really have very tangible action plans with new innovations that really we will look into and see if we could go forward with your great ideas. And really, I must congratulate you again for such great insights.
Okay, so we again repeat each other in different words, but doesn't matter. I think so. So I think that since all the presentations had those three elements, patients, doctors, and also the administrative staff, which is, I think, important. They can be doctors themselves, but all the perspectives, they are needed, all of them, to understand. But in addition with this, I'm myself very fascinated with the idea of this movement from sick care to health care. And because that must be, or that may come from my own background, long background in the prevention research, and all kind of sometimes quite loose expectations that if we all would move enough and eat healthy, and that's not, it's just part of that. But in addition to that, there's I think the most important thing that also the patients themselves, they have responsibilities to take into account that they just cannot be passive respondents of, for example, social health, welfare, and or health care. And I don't know, perhaps we discussed with some of you when you were preparing this, and I think to get more pressure to that part, which actually is taking place next month. There's Social Health Ministry starting a new program of Terveydeksi that gives more importance to this kind of preventive activities. Then we could get some more advantages what you expected, both for the doctors who are overwhelmed with this, I mean, the sicknesses which does not disappear. It does, and also to this main question, which is that what is the ultimate meaning of healthcare? Is it just to save? Is it to make all this as minimal cost? Or I think it's not, but it's just to find some kind of equilibrium between these preventive actions and the services which are needed, but to give a little bit more pressure to this preventive part.
Great. Veli-Pekka.
Thank you. I'd like to add, I agree with Riitta, of course, but a couple of things about your great presentations and great ideas was that we talked about the economic outlook in Finland. So even if we won't get like added resources, all of the group's ideas actually can be done cost neutrally, and they could still increase the quality of care, increase continuity, foster the follow-up culture, which is a driver of continuity, of course, and then increase the time that the professionals can engage with the patient. So really, and what I also enjoyed very much in each of your presentations was that you all had an element of co-development and co-innovation, which I think that I've often thought that we have a population of 5.6 million in Finland, so that's not a very big amount, and practically everywhere in Finland, the public healthcare system is facing pretty similar problems. There are of course differences between big cities and the countryside. But I think that maybe instead of trying to, as someone said, that trying to create some national model and then try to implement it everywhere, we should foster this kind of culture that we build networks of individual units in Finland that can communicate with each other and share best practices and co-innovate and co-create.
Mm-hmm. Yeah, no, that's a very useful way of thinking that how do you deal with the great variation that we have in the system, both in terms of the models that may be needed, but also in terms of the ideas that already exist in there. I think just maybe as a concluding thought, what I've enjoyed very much is hearing here and actually also in the morning, how much of this actually doesn't have to do with medicine itself, but has to do with how teams collaborate. Somebody mentioned, yes, there are teams, but maybe in name only, not in practice. And so how do you build certain kinds of cultures in there? How are political decisions made that in a way create a broader context for social health and these kinds of questions? And so I thought that was very interesting to sort of observe and sort of see throughout the process. We've come to that happy, sad moment where we can both celebrate the conclusion of the course, but we have to also wrap up this session. So I'm going to maybe ask everybody to give a great round of applause for the panelists here. And Mä voin ottaa ton mikin. And then I'm gonna ask my partner in crime, Nuria.
Just to wrap up the session, before you go into celebrating and we let go our guests, we wanted to just remind you that whilst this course ends and our partners' work continues, we start to think about the next year. And we have an open call, so we believe we will continue to work with Kela because this continuity of care continues also with DFG. So we're very excited about this. We're looking also for other partners to join us next year. So there's an open call. Contact us. We will share our details also through our website, and also you can hear later this recording. And then we also want to announce that it also continues the celebration of Design for Government 10 years, and it will continue in October. We have been invited to join an event, a couple of days, the 1st and the 2nd of October, with the Gov Design Network. So if you are around, please come and join that link where they will be posting more information about the upcoming events in October. So we continue the celebration by discussing the role of design in government. And now, yes, it's the closure of the course and the final show. We want to thank you, first of all, our partners, because without projects, this course doesn't make any sense. We need your challenges to make this course happen. We want to thank you, especially the trust that you have in us, because you're working on these things. This is not a made-up, possible future project. This is something you're working on now and has a lot of pressure, and it's very important and urgent. So thank you for the trust. We want to thank also Kela for hosting us again. This feels like home to us. Can we stay a bit longer? Thank you so much for welcoming us. And then we want to thank students for all the energy, the passion that you put throughout these weeks, and the good work that we have seen also at the end. It's brilliant. Thank you so much. And then we want to also thank the people behind the scenes from Aalto University, starting from Carlota Carvalho and all the volunteers who have joined us today. Naoko is there. Naoko also, who is behind the scenes from Creative Sustainability Services, are also helping us make things run, that the course and everything is happening. And then we also want to thank the production team. We want to thank Aisea Arce, who is back there taking pictures. And then Elias, thank you so much for, again, another good year. We will be sharing the video recording of this event on our website, but also in 2 weeks, our students will have some reports that they will contain all the proposals and everything that they have explained today in a document. We call it proposal document. And that will also be available through our website. So please stay tuned. All of this will come available through our website, and we will let you know when everything is available. So that's the end of today. Thank you very much. And please, students and partners, stay a bit longer, and let's have a short celebration together. Thank you so much.